final speech. This is my audience.
Okay, imagine with me experiencing the feeling of not wanting to meet new people, trying to avoid mirrors at all costs, and feeling like putting a paper bag over your head would be better than going out facing the world. These are all feelings that are commonly linked to someone suffering from a bad case of acne. Even though acne is not life-threatening, it can still hinder a person from truly experiencing life. But for those feeling this way, know this, that there is hope, and that hope is found in a drug called Accutane. Now, the motivation behind this topic comes from the fact that until I was about 17 years old, I suffered from stubborn acne. I tried every medication and topical ointment the doctor prescribed, but none of it seemed to work. Accutane was the last drug I tried, and it ended up being the only thing that really worked for me. And the second motivation is I am personally interested in dermatology, and I hope to specialize in that field someday. Now let's look at the definition of Accutane, or also known as isotretinoin. It is a drug that comes in the form of a pill that is used as one course of treatment for about 5 months, and it helps to treat severe acne. It is a drug that should only be taken after other medications for acne have been tried and have not proven to work effectively. Now, there has been quite a bit of controversy surrounding the drug Accutane. There are some who think that it works wonders, while there are others who think it shouldn't be used at all. Today, you will be able to decide for yourself, from the information I share, whether or not Accutane should be used. Over the next few minutes, I'm going to discuss the positive effects Accutane can have, the potential negative effects Accutane can cause, and my personal experience with Accutane. First, let's take a look at some of the positive effects of Accutane. Well, mainly, it clears up stubborn acne. The drug is able to do this by producing a rapid inhibition of sebaceous gland activity. This happens within about 2 to 4 weeks after starting the treatment. The drug also decreases intrafollicular lipids, which are known to cause acne. Another action that Accutane has that causes a decrease in acne is its anti-inflammatory properties. The second positive aspect of Accutane is that it not only treats the acne you have, but it also prevents future breakouts. It has been shown that with one treatment of Accutane, the majority of patients experience complete and extended reduction of their acne. The final positive effect I'm going to discuss is that it helps to boost self-confidence. Now, when I imagine self-confidence, I picture a lady such as this in figure 1. She looks really happy and just comfortable in her own skin. I found a story that portrays this aspect of self-confidence. It is about a woman named Julie who suffered with acne from the time she was in high school until college. She tried everything. She would style her hair in ways that would cover her face. She would use a lot of makeup. She tried every medication and topical ointment, but nothing seemed to work. During this time, Julie says that she was really unhappy. She didn't have much self-confidence, and she didn't really want to go out and meet new people. But then when she was 22 years old, she discovered Accutane. And within 3 months of starting the treatment, all her acne was completely gone. And at that time, Julie said her self-esteem skyrocketed. She had more self-confidence, and she wanted to go out and meet new people. Secondly, let's examine the potential negative effects of Accutane. Well, since Accutane works by decreasing the amount of oil the skin produces, the patient's skin has the potential of becoming dry and irritated. Along with dry skin, the nose and eyes can also become dry. And as a result of being dry, the nose might be prone to bleeding. Image number 2 here portrays the next potential negative effect. Some who take Accutane are prone to feeling more down in the dumps or experience the blues or even experience depression. Now, depression could be thought of as the most controversial aspect when dealing with the use of Accutane. There is still a debate over whether or not the use of Accutane causes depression. There are even some who claim that Accutane has been the cause of certain suicides. The final negative effect is birth defects. Now, this is a concerning area associated with the use of Accutane, especially with young women. Now, if a woman is planning to become pregnant or is pregnant, should under no circumstance be on Accutane. And if for some reason the woman does become pregnant while on Accutane, and the fetus is exposed to the drug, it has the potential of developing birth defects. Some of these include smaller head, mental retardation, cleft lip, missing ears, or other facial deformities. It is such a serious concern that women who are able to reproduce must be on 2 effective birth controls 1 month prior to starting Accutane. And also, 1 week before using Accutane, women who are able to have children need to have a pregnancy blood test taken to make sure that they are not pregnant. And then the rest of the treatment, every single month, they will have this test retaken. And finally, let's take a look at what I experienced while taking and after taking Accutane. Now in figure 3 here, this is a picture of me when I was 15 years old. And as you can see, I have acne on my chin, my cheeks, and my forehead, and I just didn't have a very good complexion. So I was really hopeful when I heard about Accutane. But at first I was frustrated when I first started it. Because like I mentioned in the potential negative effects, my skin became very dry and irritated. But that lasted only for about 2 months. I also became mildly depressed and had mood swings. Now, I personally don't remember having the mood swings, but the people around me who were with me at the time said that I was more moody than usual. But I do remember feeling more down in the dumps than usual. But I was never to the point where I felt like I wanted to commit suicide. But once the 3rd month came, that all changed. Because my skin completely cleared up, and I noticed a huge difference in my complexion. It seemed almost instantly my mood changed. I was happier with the way I looked, so my self-confidence was boosted. And since then, which was about 5 or 6 years ago, I have not had any real problems with acne. So today I have shared with all of you the positive effects of Accutane, the potential negative effects of Accutane, and a brief summary of what I went through when I was on Accutane. I hope I have helped to increase your knowledge about Accutane so that you are able to decide for yourself whether or not it should be used. But remember, this was just a small piece of information on Accutane. So if you feel you are a candidate for the drug, make sure to discuss it thoroughly with your doctor.